Okay, hormonal changes affects certain ages in our lives, both as women and men. For women, it's at puberty, when our ovaries start to work and we start to menstruate as women. So this is the first hormonal change that all women go through. This usually is handled naturally by our body, and our teenager time, which we all know most prominently, is girls or young women start to develop their periods, which means ovaries are starting to function. And together with this, there is also hormone changes that changes and matures a lot of the growth and development of the body alongside with the periods. Similarly with men, of course, when they start to be able to produce, masturbate, this is the same stage when hormone changes happen. There could, of course, be problems in certain people with hormone changes at this stage of life, which is stage of puberty or menarche or start of men's ejaculation process. Then there are the natural second hormone change phase, which happens again when menopause happens to women, which is when ovaries start to run out of eggs and stop functioning. They don't immediately stop, but they go into a transition phase when eggs start to run out. So this is accompanied by a lot of hormone changes with a lot of implications on the woman's health, lifestyle, psychology, everything more or less in her life and function, both physically and mentally, gets affected. By the way, men have the same, and that's why we call it andropulse, not menopause, which similarly, when the testosterone levels produced by the testicles start to go lower, again, the body starts to suffer the effect of this change. The problem in the past, in the old times, these changes were not given attention to because they were taken as part of nature. Human beings didn't used to live long after menopause, and were simply told to sleep on it and live with it. We live till 80, 90 years old, so you've got at least 30 to 40% of your life is in this phase. And this phase, you are still working, you're functioning, you're responsible, you're not in pension or retired, and you want to maintain your function and your body health. And that's when started women all to highlight and speak long after being suppressed and asked not to do that and just live with it. But now women are starting to be educated, and we're trying to educate and aware, make them all aware of how to live with these changes, what's the best way to treat them with, and to give the best quality of life, and to reduce any risks in relation to these hormone-related changes for future, and give them protection also. Equally, men have similar issues that also can be also tackled and sorted, simply because we live longer and we now don't have natural body functioning giving us hormones, so we have to just look into how we can handle this and how we can replace this. I spoke about natural hormone changes initially. Of course, there are other medical conditions which have hormone imbalance during life, which is a medical abnormality. Like women, for example, who have a very common condition called polycystic ovaries. Polycystic ovaries is not ovaries that has cysts, which a lot of women misunderstand or misinterpret. It's actually a hormone imbalance again. Why? Because ovaries are stubborn, they don't ovulate regularly every month, and as a result of this, there should be a certain natural pattern of hormones during every cycle that the woman should go through, and this becomes disturbed, and as a result of this, problems then happen with regards her femininity, her reproductive system, her ability to have children, irregularity in her periods, and other related hormone imbalance problems that can end with her body gaining weight, her skin, her hair becomes again suffering because it's all to do with imbalance of hormones. So these are then medical abnormal conditions of hormone balances, like the polycystic ovaries. However, as I said earlier, the natural hormone change, which is the menopause, simply we leave it to the woman to realize when she needs to have help. She will start suffering. There's a whole list of every part of your body gets affected. And this is what women used to start crying about, starting with short-term symptoms of your vasomotor system, i.e. hot flushes, night sweats. Then sleep, very poor sleep, can hardly sleep. Then brain becomes affected. The woman becomes very anxious, is not able to focus, concentrate, and always saying, I'm very foggy, I have brain fogginess, I'm not right, I'm being aggressive to everybody. So brain becomes even totally disturbed. Then body functions all also become disturbed, starting from irregular bleeding. As a result of the hormone imbalance, she can also be at risk of having abnormalities in her uterus or polyps, or can later even have some cancers. The next thing is her body weight, because one of the main hormones that gets affected is insulin, which makes us more prone to diabetes. So women at the age of menopause all have a tendency to have some insulin resistance. And that's why in life, we develop diabetes called type 2 diabetes more at the time of menopause onwards. So the woman always have to know about the lifestyle, the diet requirements, how to exercise, keep fit, because all this hormone imbalance affects the ability to deal with everything you eat. You become resistant also to insulin. So you become almost having a tendency to being diabetic. You develop overweight. You put on a lot of fat. Then your heart gets affected. You become then very prone to having heart attacks. Cholesterol goes high. And then diseases start to kick in of aging. But all again related to hormone imbalances. So women need to be aware that if we balance the hormones, but also education on lifestyle and diet, and that to know that the benefits of hormones at the age of starting the menopause, not necessarily as they used to think when the period stops. No, you actually start going into the change from 10 years or 15 years before menopause. Like to expect from mid-30s onwards, all women, when you ask them, they will start to say, yeah, my periods are starting to change in frequency, in the nature. I'm starting to get these symptoms. I'm not sleeping as well. I'm putting on weight, although I'm not eating as much, or I'm exercising too much, but still I'm not losing weight. I'm going to the loo very frequently because, again, hormones has a big role in the women in control of bladder. Very important thing about sex, women tend to lose their desire, their libido, which upsets them. A lot of relationship breaks. They don't realize it's not their fault, it's nature, but it can be corrected. They start to have, again, their vagina, it has a lining of bacteria, all changes, becomes very dry, very sore. Again, they start to hate sex because it's very painful. They get recurrent infections, and they have to live with all this silently while they are majorly suffering. The family is suffering, relationships are breaking, women in highly professional positions can't do their jobs in their work, and everything is just messed up. All because of simple hormone changes that we need to adjust, we need to be aware, and we can replace, and we can live with various things and options that can be offered to women to be able to cope through this time of life until we die. Because all the hormone changes does, as I said, provoke our risks to having brain troubles, which is Alzheimer, dementia. It's also related to having heart troubles, which is heart attack, It's also related to having diabetes, as I said, strokes, the other one as well, bone loss, because the bone density becomes very poor, and this is the second common cause of death after the heart, which is fracture to the bones. So all our body simply starts to lose its integrity.